What is a genetic mutation? A genetic mutation is a change in the genetic base sequence that can lead to a genetic disorder. What is a genetic disorder? A genetic disorder is a mutation that changes the function of a protein causing a disease. Here's some statistics about hemophilia A. Hemophilia A affects 1 out of every 5,000 male children in America. You may be wondering, how do doctors diagnose hemophilia A? A blood sample is taken from the test subject to test the concentration of factor VIII protein in the blood. If the patient is lacking that protein and shows physical symptoms of hemophilia, that person most likely has hemophilia A. One way hemophilia A is treated is a process called replacement therapy. Clotting factor VIII is slowly dripped or injected into the vein. That process can improve blood's ability to clot normally. Hemophilia A is a sex-linked disorder. Therefore, it is found on the 23rd chromosome, or otherwise known as the sex chromosome. It can be caused by a base pair substitution type mutation. A base pair substitution is when a base pair in the genetic code sequence is replaced by a different base pair. The protein that is affected by this mutation is called factor VIII, or F8. This protein normally starts a chemical reaction to start blood clotting and make bleeding stop. The mutation causes them to be dysfunctional and not work properly. Hemophilia A causes long-lasting bleeding and bruises. Without blood clotting, you could bleed out. Okay, so some of you may be wondering, how is hemophilia A passed on? Well, let's take a look at our Punnett square here. Imagine the person on top, that's the X and Y, is the male. The person on the left is the female. Now, an uppercase H represents a healthy F8 gene. That's the gene that generates factor VIII protein, which allows our blood to clot normally. And lowercase h represents hemophilia, which is unhealthy. Now, each one of the squares in the center portion represents a different offspring. Now, look here. 2 of the offspring will be normal. They won't carry the gene at all. 1 of the offspring will be a carrier of the gene, whereas 1 out of the 4 offspring will have hemophilia as a disease. Hope you enjoy the movie. Hopefully it made you about as excited as this kid. Thanks for watching.